Hi, Fritz.
Hey, Sanaa, it's good to see you.
Good to see you. Welcome to another episode of In Dialogue. I'm
Yes,
Sanaa Hyder. I'm with you, Dr. Fritz Gillette,
yes,
and today we're talking about identity.
great topic, and always excited to have these conversations with you. But I know you've got a guest. Who do you got for us today?
Yes, I have Dr. Dominic Canova, and he will be joining us. He's also a psychotherapist, and my hope for today is to get into what it means to have an evolving identity.
We're going to solve the identity thing today. That's what you're here for. So if you're just tuning in, we do this. Sanaa and I often get together, record our conversations, and we found them useful to share with you. And then we've decided, oh, let's bring other people to the party. So looking forward to talking about
Yeah,
identity.
yeah. And hoping to have conversations um, and almost, don't want to say reinvent the wheel, but in a way to have really real conversations about the things that are really top of mind um, for other clinicians and other healers.
Great.
Mhm.
Without further ado, let's where do we have the Dr. Dominic? Are they in the green room waiting for us? The proverbial
Yeah,
green room?
not here yet.
Not here yet. Okay. So, when I think of, a few years ago, I was talking with a colleague about the concept of identity. And one of the things I think we have wrong about the concept of identity is it is this singular thing. People are often trying to find their true singular self.
Hmm.
And we have a multiplicity of parts and personas and parts of us that show up in different instances. So when I think of identity, I like to get into clarifying that with people and talking with them about how our identity is an evolving, amorphous thing, changing
Hmm.
the environments and the circumstances we're in.
Yeah. Um, and I think of particular interest to me regarding identity is this phrase that I've coined, which is the in-betweenness of being brown.
Mm,
And this has been so relevant for me because it's felt very much like between my second generation immigrant identity and uh, my social location and living in the West, but always having sort of this inkling of, well, I have my ancestry in the East, and what does that mean? What does it mean for my family? Especially as immigrants, there's a lot of carrying of the way things used to be, or different living in different cultures,
mhm.
and so these are all sort of threads that I'm constantly pulling at in terms of my own identity and what it means and the way that other people then interact with me.
Mhm. Our identity it's a quite a complex thing if you think about it, and it can actually also be simple. But the thing I think we do by when we oversimplify it is we might make it very difficult for us to see the complexities of how life pulls us in all different directions. You and I both have a personal and professional persona. We have different personas that show up in different situations with different people. When we are, let's say, with people who are of a similar culture and background, there might be assumptions we're all making about one another, and we're not
Yeah.
a no one person is a template for anyone else. And so I always encourage people to be curious about how another person's experiencing a particular moment, and we
Mhm.
often can get information about their identity and how they relate to the moment
Yeah.
based upon those answers.
Yeah. I was having this conversation with someone, and they said something about how on their journey, they're now bringing their whole identity to all the spaces that they're in.
Yes.
Because I was talking about how I feel in this part of my journey that I am different people in different spaces, and that I notice that in my body.
Mhm,
And that there are still spaces where I don't feel like I can bring my full self, or maybe I don't really know who that is in that space.
mhm.
And they were saying that they're in this part of their journey where they unequivocally, unapologetically bring their whole self into every space. And so who that space is made up of is no longer as relevant. for them in
I'd
terms
love to definitely get into that today and exploring that, because I mean some of that stuff can sound out there for people, hear people talking about bringing their full self, but what does that really mean? The other day I was giving a presentation and I got into it in a very conservative room about the concept of a full self. A full self means that, Fritz in the 1990s was a math teacher and learned some things that might be useful in this moment. And Fritz is a brown man, and that might be useful in this moment. And Fritz has this experience and that might be useful in this moment. That is, if the environment cares to receive or is accepting, or the common word is allowing for a safe space for that genuine, authentic, full self to arrive. But as someone who's talking to people from an older generation, many instances, a lot of this language is out there.
Mm,
And, I usually ask them, when you hear people talk about even full self, what does that mean to you? Is that some, woo-woo stuff, or does that make sense to you?
yeah, yeah. And I think that we can see that in our clients as well, that it could be that with some clients, it takes some time to sit with and to have them go inward and access, well, what are all the different parts of themselves and what do you mean when you say whole self? And there
Yeah,
are other clients I have who will instantly get it
yeah,
and instantly have access. And I think some of that is protective and useful. And I think that I've been framing it that way a lot, which is that um, a lot of us have learned that parts of us need to be pushed aside in order to be, better or to be able to survive in our environment.
right. And we're taught that from childhood. There is, use your inside voice. So the
Oh,
outside voice part is told to stay
yes.
outside. And we're taught a lot of those lessons. When we're talking about the differences, some people are brown and some people are other, and so do some people have more privilege
Hmm.
to be their whole selves? Do some people never really have had to think about it because maybe they were the dominant culture and their full self is mostly what the culture understands and welcomes? And then if you hear how I talk, I remember working in a youth program in the late 1990s, and a young child, African American child, said to me, "Why do you talk that way?" And I was bringing this version of me, which
Yeah.
is the main version of me that speaks, but
Yeah.
she was like, "Why do you talk like that? Why don't you talk like this?" And she went into some other thing
Yeah.
that, to me, that wasn't my normal operating way of speaking.
Well, speaking of that, let's bring in Dr. Canova.
Hello. We're connecting to audio. This is the new world of Zoom transmissions and recordings that we're also now used to after the pandemic. Dominic, can you hear us?
Yes, I am here. Sorry about that. I was going through my laptop and then it was saying I needed to update.
Oh,
And
yeah.
hi, it's Patricia Sheik.
Hi. Hi,
Happy
Dominic.
Valentine's Day.
This is Dr. Fritz Galette.
Hey, it's a pleasure to meet you.
Pleasure to meet you as well. Pleasure to meet you as well. We were just starting to we were playing with the topic of identity
Yeah.
and talking about kind of the things that come up for us around it while we were waiting for you. So
Yeah.
I talked
Thank
a
you.
little bit about identity. Often is phrased, people are thinking they're trying to find their self in a singular way. And then Sanaa, you can jump into what you were talking about too, so we can get Dominic up to speed.
Yeah. Well, Dominic, you and I were talking a little bit before about this, what it means to not have this one identity, but to have so many different identities, and to, on this journey of life, unpacking what all of those mean. And maybe this is something that's always ongoing. And so let's talk about that. And before we jump in, let me talk about who you are and introduce you a little bit.
Thank you.
So, Dr. Dominic Canova, you're a licensed psychotherapist who treats clients through private practice and teaches future therapists at Fordham University and provides consultation services to various workplaces. Dr. Dominic Canova, known on social media as Dr. Domenico, speaks on issues related to trauma, the LGBTQ community, adolescents, performing arts therapy, immigration, career counseling, and the COVID-19 pandemic. It's great to have you on.
Thank you. No, and thank you both so much for just inviting me on today. I really appreciate it. It's awesome just what the two of you are doing and what you guys have developed. It's really exciting, and I'm so happy to be here. And Sanaa, I mean, we haven't seen each other probably since we graduated in 2015, so it's
Yes.
been quite a while. So
Yeah.
this is really fun today.
Yeah. Dominic, would you like to jump in and talk about like where you locate yourself in terms of your identity?
Yeah, no, definitely. So thank you. So as we were talking about just the other day, it's really interesting, right? When we look at race, we look at ethnicity, and just it's something that I think fascinates all of us. And for me, it's something that is still, something that just it comes up daily. It comes up daily for me in so many ways. So I was born in Cartago, Costa Rica. I was adopted when I was one. My parents both sides are Italian American. I grew up in Pittsburgh, Pennsylvania. Very Italian American neighborhood, just with a lot of extended family, and it was very. I mean, still to this day, it's very fascinating. Just walking out of your home. I think more so, and just for me at least, in navigating the world and who you come into contact with, and how people perceive you, and how people will maybe get it. People a lot of times don't get it. It's very, very fascinating.
Mm-hmm. Yeah. Yeah. Thank you for sharing that. Yeah. When you say people get it and people don't get it, do you have the sense that you encounter that you're actively choosing spaces now where you feel like people will get you, or has that changed for you where you feel more grounded in yourself, that it doesn't matter?
I think that's a really good question. I think that when I was younger, there was much more gravitating towards a specific space. I definitely um, feel that more like growing up, and then as a very young adult, like an emerging adult in college. Um, there was also where I went to college. I mean, it was it was in rural Pennsylvania, extremely Caucasian, extremely conservative, actually. So there was definitely not, I think, just in general, even ethnically, honestly, like in addition to race, just ethnically, not a lot to choose from.
Mhm.
So it was interesting in terms of that. And I think just, I mean, over the last, it's been longer than 10 years that I've been out of college, but the over time, it has evolved and taken a lot to get to a point of just, um, in my life, of just, this is who I am. And, this is one part of myself. This is another part of myself. And, it's really just, I'm very content with who I am today. And if somebody doesn't understand, I mean, that's their journey to go through. I don't need to go through teaching every single person that I come into contact with on the job or at work or just an acquaintance, just about my lived experience.
Mhm. I'm wondering, I'm trying to get that picture in my mind, rural Pennsylvania, not diverse at all. You're growing up in a very Italian American neighborhood and an Italian American household, and you're meeting new people, going to school and all of that, did your parents have a conscious or any kind of um, conscious attempt to try and help get you ready for that? Were they aware of how you may be received?
You know what? They were, I, my parents just, when I was a child and just from very young, they were extremely, I'm trying to think of the word to use to describe their behavior. I mean, just extremely, it's not, I mean, it's way more than hands-on, just extremely, I guess it would be encouraging of, you were born in Costa Rica, we adopted you. This is your experience. I mean, I can't even remember how, honestly, if it was like 4 or 5, they had me enrolled in Spanish classes. There was so much conversation still to
Mhm.
this day that goes on with the foster family. So I think that there was such an infusion of that, and just like, we want you to know, we want you to be involved, we want you to embrace that because we do. And there's just so, I mean, conversations like all the time in our household just about that. Still to
Okay.
this day, just the memories from that. So I think that, um, yeah, that there was always just such an encouragement and just such an emphasis on embracing it. And it's something to be prideful about.
Mhm.
So then you go, so that's, your family, that's where you've grown up. Everyone kind of knows you, and knows the experience. It was very public. It was a very public experience as well, too, when it occurred in 1990, 1991. And then you go to a college, like, people don't know you. And I think that I just think that it just depends who you talk to, because I think on top of it, on top of the race and ethnicity piece, is the adoption piece. And I think people just ask very, I think, insensitive questions to just
Yeah.
people that are adopted. And I don't think that people ask the parents. So I don't even think, like, my parents ever really received questions that I received at times that were just extremely hurtful, extremely insensitive, and extremely just, I think, honestly harmful, to, I don't think it's just, I think anybody in the situation that's kind of gone through that.
Right.
Mm,
I mean, I'm thinking back to a time when my parents, knowing they were sending me into very non-integrated schools, so very conservative places where there wasn't much diversity, there was some level of the talk or some level of, you're a brown person, or you're not like them, and the way that you look. And so there's some level of preparation. It's interesting observation to note that when you meet new people and they have a disconnect in their head as to what are you, they don't necessarily beeline to your parents to get the answers. They go to you, and sometimes that what they do is downright insensitive.
I think so. Yeah, it's really just, it's really unfortunate. And, I'm talking about. I know that I started today talking about undergrad. I have to say that, to be completely honest with you, I've had way more experiences with people like in their 40s and 50s, people that I've been at the workplace with. When I was definitely at I mean, we were definitely, I mean, it's not like we were at Fordham by that point, where there were just a lot of insensitive comments at the work where I was working. Kind of
mm,
made it.
mhm.
Really.
Yeah.
Yeah.
I'm a Fordham graduate, by the way, 3 times over, Rose Hill.
Oh, that's awesome. Go Rams.
Thank you. I mean, I could tell you stories for another episode of how many times on the campus I was microaggressed against because there weren't too many people like me up there. And I'd be carrying a biology book, going from the library at midnight and with a big book bag, and the security guards would come up to me and say, "You're a student here?" And I go, "What person who doesn't belong here would be carrying these chemistry and biology books like this?"
Yeah.
Um,
Yeah.
yeah.
Well,
Oh, yeah. It makes me think of this question that's almost this like trope now, which is, yeah, but where are you really from? Right?
mhm.
Which,
Oh, yeah.
and for me growing up, I went to a lot of international schools growing up, and yet, there was this sense of I don't really know what to say when people ask me, where are you from? And there's a story, right? That my parents are from India, but I was born in England, and now we're living wherever we were living at the time. And so that felt for me like, well, everyone's got one answer. Everyone's got this sort of solid thing, and I don't. So I wasn't sure, what was going on for me. And until we came to New York, I was in middle school, it was so relieving because you can say you're from New York, and that
Yeah.
it just includes everything. And so it became this really nice the solution, I think, for something that I was struggling with for a long time. But then there's these other pieces like you're talking about, in my experience of like people not knowing how to pronounce my name, or it being like very hard to uh continuing sort of experiences of you know where are you really from, or why don't, and in some circles, especially culturally, it's why don't you embrace your culture more, right? And then in some other spaces, like this curiosity, like, oh, your family's Muslim, like what is that?
Wow. It's
Right.
Justify yourself.
it's it blows my mind at times just what I mean. I don't know if it's, it's so interesting. I was talking to a client about this yesterday. I don't know if it's like, I guess it would be emotional intelligence at this point of just, I think just how we communicate and ask questions and just, I mean, etiquette, but also just there's a piece I think as well of just what information when we're meeting somebody are we entitled to ask and to have. I mean, we talk about career counseling. You look at legally, like what you're allowed to ask in an application or in a job interview, or when you're getting, I mean, obviously at the workplace too. We have that, and then just socially, it's really unfortunate. I think the way that people just go about just, I don't know, just really not knowing how to speak at times.
Mhm. I It happens on such a pervasive level. It's ubiquitous. No matter where we are, that the pure psychologist in me, the one that's not even looking at it from a scientific perspective, sees that it seems like these humans have a tendency, whenever they see somebody that is out of the category that they can easily identify, that they will attempt to try and categorize that individual. For
Yeah.
what purpose? What is going on for them? And because it's happening so pervasively, we can be boggled by the fact that it's happening, but it's happening, and it seems that we as humans do this to a certain extent. What do you say to that?
Yeah.
Wow. It- I just agree with you that it boggles my mind as well. And I think it's so interesting, Sanat, because I'm thinking back to our first semester, this instructor that I think that we both loved that we had, and I think talking about, and I remember having this her having this conversation with us in class about just there is something about I think with human behavior. People love to box. People just, there is something about just being able to put you in a box. Now, you're Muslim, you're from New York, whatever, you're from India, whatever your family is, like whatever the situation is, people love to go and be able to do that. Um, to just, I think, just have some quick reference, like it's like a library catalog, or even I think now today it would be like a hashtag, like forensic psychology versus um, multicultural counseling, right? And that I know exactly how to. It's so interesting. I think actually today we could look at it like niching people down.
Yeah.
Like right, like it's so strange.
When I think about it, I think of the like, oh, that feels safe. Like if I met someone and I knew instantly where I could put them,
Hmm.
and suddenly it's like, Oh, okay. So I'm feeling really soothed in my system because I feel like I understand something. And I think the other piece of it is like this, maybe this belonging piece of like, do I know where I stand with them? Do I know where they belong? And how do I belong in the situation now that we've done this? You know, we've
Mm,
introduced one another. And it's taken a very long time for me to get to a place where I even notice that other people are uncomfortable, right? Fritz, to your point of talking about how when you get to a certain place in your life, and for you too, Dominic, where you're noticing how other people are reacting to you. And that I've noticed recently, like as a like fully grown adult, that um, oh, this isn't about something else. This is actually a microaggression.
mhm.
This isn't about this. And I'm moving from a place of noticing what the world is like to a more conscious place of wanting to choose how I embody my identity
Mm.
and what that means for the places that I'm in. So going from like oh, I'm really scared to like a reaction to someone or not feeling like I belong anywhere to then wanting to consciously choose what it feels like for me to inhabit this body that um other people might have opinions about, but what do I think about it? Because we've been talking so far about other people. We have our own opinions about our identity,
Yeah.
constant shifting, which could be like, you know, disgust, wanting to push away parts of ourselves to loving parts of ourselves or having a very complicated relationship, with our culture, with parts of our identity. So do you feel like you've um over time felt like even though you encounter people who might be curious or asking these questions, that you feel like you're inhabiting who you are in a different way?
Yeah, no, I think so. Thank you for that. And I agree so much of just what you said and just how you worded that. I think that yes, it's something that in my 20s that I definitely think by moving, to New York and being around a lot of different people, and um, then and what was actually so fascinating is being in uh, somewhere like New York and still people not getting it, and like right, like it's like wow, like we're doing this again, okay. So it really doesn't matter geographically at some point. And that um, I think that for me, it's I think that just having a lot of these different experiences, if it was at the workplace, if it was I don't know. I mean, I don't really remember if it happened in like graduates, like in any of the graduates programs so much, but I know at the workplace and just personally with meeting people in different ways, that I just got to a space of just, I know myself, I know my family, I know where I came from. And that's enough for me. And that's what's working for me is that. And I'm at the point now of just, I don't, if I meet somebody professionally or personally like new, that, I'm asked the question and I explain it, that, I'll answer the question. And if that person gets it again, like that's their experience, that's their thing. And just honestly, depending how invested I am in talking to the person, more than likely now, like I probably won't go into it unless I feel that the person's very respectful or just really cares in some type of meaningful way.
Mm.
Yeah, but like if you're just, I don't know, asking just for information or just it doesn't seem very authentic, I'm probably not going to lean into going further with it and really care what the other person's opinion is either.
Oh,
What makes me think about in a moment is when we get to a place in life where we're comfortable in our own skin, as you both said, you kind of get to a place where you know yourself, you know your evolving self. you're comfortable, and you can then see when people are trying to fit you into that box. You can see the difference between people that are curious, genuinely just wanting to learn and get to know you and in a good way, and people who are trying to make themselves feel better by ticking off the box of having figured you out. It That's a big difference. And so when you get to that place of being unapologetically who you are, you can almost say to someone or realize before you say it, sounds like a you problem.
Mhm.
And I have actually said to people as a response, nicely though, is seems like right now you're trying to figure me out. What's going on for you?
Yeah, yeah,
And the comfort with which we talk about who we are and the different facets of who we are, I find a lot of times squashes some of those insensitive approaches.
I think that that's great. Yeah, I agree. Definitely in terms of that. I think that there has to be, when I'm hearing you speak, I just feel that there needs to be some type of boundary. Like there has to be that created for all of us when we're navigating just people asking who we are and what space do we fit in, and all different things in terms of that. Am I Latino enough? Am I Italian enough? Whatever the situation is.
Mhm. Yeah. Uh, Fritz, you used the word evolving identity, and it made me think about how us inhabiting identity, and I think it took me some time to figure this out, and I think I'm certainly evolving through this constantly, which is I'm allowed to change my mind about how I feel about my identity, and that it's not this fixed thing, and I'm allowed at any age or any point to say, I no longer want to practice this thing, or no longer want to do this, or I want to do this and it might not be part of my culture, but I like it, so I want to try it out. Or that I can be, moving around in that way, or parts of different groups. And um, I think that before there was this constricted feeling of you are this way, or you have to be this way, or this is what it looks like. And I think especially, I think different immigrants have different experiences, but certainly part of the immigrant experience is, well, who are we now that we're in this new place?
Yeah.
And this carrying over of some parts of identity. And I know that certainly sitting with clients, there's this fear of, not reluctance to, something about, I don't know if I get to choose my identity, but I certainly want to. And I don't know if that's going to be insulting to anyone, certainly in my family or relatives, but also, do I get to pick my own identity? Right. And Dominic, you said something interesting about your own sort of personal boundary of who you let in and how you decide. And it sounds like you got a really great setup to be able to do that, right, in your family life. And I'm curious how you work with clients who are, want to keep evolving their identity, but there's a lot of fear around it because, again, it could be that societally there's this encouraging of like, you can be whoever you want to be, but maybe inside the family, there's this is the way, right?
Yeah. So with clients specifically, how do I navigate?
Yeah.
It's been, it's been, I think, just such a gift, like being able to do what we do and work with people. And now being out of school, and honestly, like immediately after school, I was working. I graduated in 2019, started in July working in the third busiest ER in the country. And then like 6 months into that, COVID started. And now I've left to do the practice and I'm doing that. And it's been interesting who I've attracted. It's not what I didn't really know. I don't know if one does know exactly just kind of the ethnic and racial demographic of what they'll end up attracting. And it's been very fascinating because it's been, I think, in some ways reflective of who I am and who I see myself as and who I know myself as. There's a lot of clientele that, are Italian, are Latino, or are both. Um, at times. In addition to what's been really fascinating to me, um, I've actually built just over time just a clientele as well of South Asian, of Middle Eastern too, which has been, um, I think, one of the most exciting things just in the last year of doing this. That has been opened up so much. When I was in school, my experience primarily was working with um, adolescents who were Black, adolescents that were Latino. Like that was primarily, so opening that up even more has been really exciting. And there have been, I mean, some people definitely do ask questions a little bit. I don't mind answering it. I mean, every person that has asked me that I've answered seemed intrigued, and I think was trying to get a grasp on who is this person that I'm confiding weekly in, that I'm processing emotions, and does this person's um, cultural lived background and experiences is I think it was I wonder I question if it's coming from a space actually of is the therapist open enough to understand or be willing to learn what my lived experiences and family background and just country of origin from the family, what my experience is. And I think that might have been some of why I was being asked that.
Mhm. Yeah.
Yeah, I was thinking in the therapeutic relationship, and I do mean relationship, there is enormous opportunity, especially if we're working with people on a regular basis, to model the adaptive and flexible back and forth of that relationship. We can utilize, even without being too personal, we can utilize as therapists our own lived experiences. And as we ask the clients questions or invite them to wonder in that space of wondering with them, and I wonder if this or that, we can actually show them the flexibility of identity, and the flexibility of how you can utilize, we're using words like identity, but I'm often talking in parts work
Yeah,
and aspects of us, what shows up. I use those kinds of examples. I ask people to notice what's coming up for them around certain things, even things that seem very easily defined. Just notice what comes up when I hear a client uses the word love. I really love this person. That's amazing. Can you tell me what comes up for you around the word love? And we could spend a whole session defining that experience and playing with on purpose the different facets of it. And I think in being that way with one another, we can definitely show our humanness and our relatability. And I think for them, that can show them, how do you do this identity thing? Well, just like we just did.
Mm.
really.
Yeah.
Mm.
Some deep and powerful stuff that we can do in this role. It's why, I mean, I'm in my 50s, so this is not 3 decades of doing this. And it just gets more and more interesting as I meet new people who are doing this.
It's fascinating. I think just as well. I think the evolution too, just like over time of just how people view things and generational and how all that kind of changes as well. I think in terms of what we ask, but then I would imagine too, to a degree of just how we conceptualize who we're meeting as well as ourselves and what it looks like and how it might look different than in 1995 versus 2005, right?
Exactly. It can just be willing to do those playful experiments out loud and with people we're with.
Definitely.
Yeah.
And I find humans naturally go with it.
Yeah, I think so. I think so. Um, I think if when you can bring a little bit of imagination into the room, and I think it's definitely the trust. When the trust is there,
Mhm.
and obviously the rapport is there, I really feel that people will follow you, the clients will follow you, and,
Yeah.
and going to a lot of different spaces to explore just a lot of different things. In this case, about parts of the whole and different parts of their identity and just how they're making meaning and formulating.
Yeah.
Yeah, so I'm hearing both of you talk about this way of using the session, or using the trust in the session to sort of play with different parts of what things even mean. So, right, Fritz, you were talking about what even words mean, or what things mean, and Dominic, you're talking about different parts of your identity. And as you're talking about this, I'm thinking about how in the room we trust our clients, right? We trust exactly what is happening for them, even when they would say, well, I don't know about this, or I don't know how to do this work, or I don't know how to trust these parts of myself that are coming up, right? And how do we help? How does your journey help you have compassion for or see your client struggling to go through this?
Oh.
I think, I think that it's normalizing just that we're going to be conflicted. We're going to be conflicted more than likely in some aspect of our life. And I think that it's pretty common for people to feel insecure, unsure of themselves, unsure of where they fit in, and how they fit into all of this and everything that's going on around them. And a lot of times, if that's going to be in an ethnic or a racial setting or experience, or both. And it's, I think, tapping into that and just allowing that space to, I think, for somebody to say maybe what they've never been comfortable to say to their family, or maybe they have been comfortable to say to their family and it's not been validated, or it's been validated to an extent, and there's something else that they're looking for in terms of emotional support. So, I mean, at least I think for me, it's tapping into it in that kind of way.
Yeah. Wow, I love what you said. Go ahead, Fritz. Sorry.
I think I almost heard the word intuition. And that's the use of self, use of experiences, having faith and trust in what's coming up. This is for the therapist too.
Definitely.
The client is like a musician. They bring in their own music. They play a tone. We're following. We're trying to get a sense of what key they're in. We prompt them to do more of that. Sometimes then we, through our intuition and experience, strike a tone that facilitates their process. And the only way that we're going to be able to do that a lot of times is allowing ourselves to feel the vibrations of what they bring.
Definitely. It's a lot of
Absolutely. A lot of improv, a lot of going with it, a lot of yes and.
Yeah. Dominic, I heard you say something else, which when you said it like soothed me. It made me feel so good, which is that you will be conflicted. Like there are going to be things on your journey where there are parts of you, parts of your identity, as evolved as you think that you are, or that you have been evolving, and you've been working so hard, that there will still be parts of you, things you're going to go through that will make you deeply insecure about who you want to show up as, how you're showing up as. And when you said that, it just it made me so happy. Yeah, because I think that's like, oh my, I mean, that's what I needed to hear too.
See, you hit a note and it resonated.
Yeah. Yeah.
every once in a while I try.
Yeah, it's like permission, right? It's permission to be, we want to be put together, we want to have a box, a label, and we get roped into that. And when we don't, or when life is changing, or when identity is changing, which is always in flux, it can feel really scary. And so when you said like it's normal to always be, conflicted, I think that this underlying search for who I am, who am I, is part of our existential thing.
I think definitely, no, thank you. I think definitely just in terms of this is who I was, when you were asking me at the beginning today, just how did I feel when I was younger at this point in my life? And I think that it does evolve, but I think that we're still moving through things. I think that we're constantly kind of moving through different stimuli, moving through different obstacles, figuring out, sorting things out, coming back to things that aren't fully resolved, I think, for ourselves. And it's just, again, just sorting a lot of that out and having to work through that in a lot of different ways. And I think at different points, it's almost like having tests, right? Where, okay, I have mastered something, in 2018. Now it's coming up for me in 2021. There was something that happened in 2019. Now it's coming back in February 2023. And it's almost like a test, or I don't know, like I even like your continue education credits. It's a little bit, if we look at it like that, right? Where, okay, like let's go and like do these 6 credits again on this topic, and let's see where we are at this point in our life.
That's a cumulative effect of life and of experience and of having experiences. Even if you're taking a course again and again, we're taking it again on the shoulders of having taken it before, with all the experiences that resonated with it or didn't resonate with it since. That's the evolving identity.
Yeah. It reminds me of how we're trying to always resolve something, and we have to sometimes go back if something has not quite been resolved and try to figure it out with a new lens or with a new perspective and understand it much more deeply.
And we're showing the client this process. If we're going to allow ourselves to be real, genuine, authentic, and present, attuned, honest in our work with ourselves. I keep referring mostly to the therapist and the dynamic, because I train therapists, and I tell therapists the most important tool you'll ever hone is yourself in how you help other people. And the more you do that, they can sense that you feel it and that you're there.
I think definitely it's so much just it's communication, and I think at times just what is being unsaid, and how do we communicate, definitely non-verbally, quite a bit. It's the body, right? It's the most important. You're talking about instruments. I mean, the body, it's in this theater background, so it's body is the most important instrument that we're ever going to have. And it's finding a way to communicate that's going to transcend through all different cultures, all different racial backgrounds, all different ethnicities, and just to communicate that I care about what you have to say. I got you. And I'm just here to just create this space for you, just to feel that you can express what you need to.
Mm-hmm. And there's creating the space. We tell them we're creating the space, so intellectually they hear it, but if we embody the space, they're going to feel it.
Definitely.
Yeah. And I can sense that even as you say it, right? That you're inviting anything. Like you can say anything you want, and I will hold a space, and it's okay. Mm-hmm. It makes me also think about how, we haven't talked about any particular kind of like therapy or intervention, but we've all talked about the body, right? And you just talked about the importance of being like wholly embodied, right? In what you're trying to communicate and say. And I've been thinking a lot about, well, what are some of the basics, or what are some of the things that if you in the moment didn't know any other tool, or you forgot all the stuff that you learned in therapy, like what are the things that day in and day out work to make connection and to create safety? And I think you're tapping into that sort of the basic, the I got you, like no matter what, I got you, like we're good here.
Yeah, I love what you just asked. It's so interesting because all three of us, all three of us teach, and I think about that a lot. I think about that a lot, and it's hard because you just get so used to doing something, and then now you have to go. Wait, how did I go back to do like step by step by step? And I think that I don't. For me, and I say this a lot to the students. I'm just like, please, like, it's just I beg them at times just it's checking your ego, like yourself, like at the door. And I just have it really is listening, because you're not going to know every single family background and every single family ritual and just value system and what is help. And so it's listening. I feel that it's listening. I feel that it's being very comfortable with being wrong and being able to acknowledge when I speak about myself when I'm wrong, and acknowledging that to the client and just say, like, please correct me if I am, and please educate me, to help me understand. So because I want to get this right to get into your world to support you.
Mm-hmm. Yeah, I want to get this right to get into your world. I like that.
Yeah. I would say it's being present, being attuned, in tune, and present. If you have no idea what to do or say, but you're there. You think of what we do when we're trying to console someone, let's say at a funeral. We could think of things that they may need and think of things to do for them, but one of the things that is really helpful across the board is them feeling like you're there, saying to somebody, I'm here. Not making them work by saying, let me know what you need to, that I need to do for you, but just simply them feeling like you're present.
Definitely. Yeah, I think that I think we saw with COVID too, what this did with what we saw when there was such a breakdown of connection. And I think just what you're describing, just showing up and just being present and what
Connection.
that means to somebody.
Right. So earlier when you said something about, you will be in conflict, and that I think resonated for Sanaa, because in that moment, she's not feeling alone in that feeling. Someone else is recognizing it and normalizing it or calling it out as that's something you're going to feel. You're not alone. I'm here.
Yeah. Throughout this conversation, what I'm hearing is that in order for us to sort of struggle with the different evolving, emerging parts of our identity, which sometimes can be very hard, it can be dangerous, it can be confusing, that it is with the not the help of, but with the witness of this really gentle presence, that you might have the ability to maybe be brave enough to move into what it is that you actually want to do. Right. And that if it's not there with family, and it sounds like in your experience there was that, right, that piece of it, and that if that's not the case, then it could be that someone might see you in a therapeutic space, or friends or colleagues that might see you and say, well, that's it makes sense that you'd be in conflict, and also that makes so much sense, and then that's okay, and me too.
Yeah.
It sounds like a lot of what we're talking about is creating the space and the container within which, because we started with identity, where identity can be not this singular thing, but what it needs to be in this moment. It can show its different facets and parts and faces, it can change its mind. We even highlighted that, but it's being as a clinician, being the vessel, the creator, and then the one that facilitates that space for identity to develop and grow and be what it needs to be.
Mhm.
Definitely. No, I think so. Immensely, just from what you just said, and it's coming just to me too that there's something so again universal that the experiences will be so heavily different, um, and just our experience walking out the door will be so different for everyone, and there's themes, right? Like there's themes that we can extract from all this, and then like I can tap into with you, I can tap into with you, and that it can help. It can help bring us together.
Hmm.
Well, this has been such a great conversation. Thank you so much, Dominic, for participating in this. And I
Thank
hope
you
that
for
yeah, thanks for coming. I hope we can do this again soon.
yes, yes, we must. Let me know. This was really fun.